Today, I'm pleased to be joined by Dr. Jody Lanko, who is a physician and the vice chair of the Department of Medicine for Lehigh Valley Hospital in Hazleton, to give us an update on the COVID situation right here in our area. Dr. Lanko, thank you so much for being here. Is the Hazleton area seeing an increase in cases? Are the hospital beds starting to fill up, or is that not the case locally?
So unfortunately, similar to the rest of the state, similar to some of our surrounding counties, we are all starting to see a slow trend upward, which has been happening over the past few months. But we've noticed it more over, I would say, the past 2 weeks. An increase in the number of cases usually followed by the increase in the hospitalizations, which usually follows the increased cases by a few weeks. And then unfortunately, about a month after the hospitalizations go up, that's when we start to see our increased number of deaths. So unfortunately, we are seeing that trend. We are seeing a significantly higher number of patients that are in the hospital, hospitalized with COVID, in the ICU with COVID infections, much more so than we were in the summer months.
Are these patients the ones who are mainly vaccinated, not vaccinated? And is this the variant that we're seeing as well?
Yeah, so about 99, I think over 99% of all COVID in the United States, 99.5% was the last number I read, is the Delta variant. So we were quickly taken over by the Delta variant as opposed to the native strain probably over the summer. So all of this is Delta. And yes, the vast majority, about 90% of the cases in the hospital are unvaccinated patients. So patients that either did not receive any vaccine or that we call under-vaccinated, might have received one of their 2 shots and never went back for their second shot.
And I understand that employees at Lehigh Valley Hospital are being mandated to get the vaccine, but there is an exception. So can you tell us about that?
Fortunately, some of the healthcare facilities, not just us, Geisinger, St. Luke's, Lehigh Valley, even before the government recommendations came out last week and the mandates came out last week, Lehigh Valley took a very strong stance that all employees, whether you see patients or you don't, need to be vaccinated by a certain date. They have relaxed a little bit in that if you've had proven COVID infection within the last 12 months, you can delay your vaccine for 12 months, but it is a delay, not an exception to the rule. So we're going through that process right now, and it has resulted in a significant increase in, say, we were waiting for the last 20% or so of our employees to get vaccinated, and more than half of those have done so.
So you do have a majority that have said, yes, I will get the vaccine.
Yes. Within Lehigh Valley, I can't speak for the other organizations, but that was the goal, is to protect our employees so that we can continue to protect the community.
And also there is talk then of this booster vaccine. What is the status right here in our area? Is that being given yet? Will that be given? Tell us what you know about that.
Sure. So right now we are offering first and second doses to any patient that has not received their first or second dose over the age of 12. So those are still available at our vaccine clinics. We have them all across our network, but at Lehigh Valley Hazleton, we have a walk-in available. We do encourage people to register to get their vaccine. In addition, they're offering what's called a third dose. So it's not quite the same as a booster dose. It's a little confusing. But that third dose is really for patients or people that are not expected to get the full immune response from the first 2 doses. So those are people that are on chemotherapy, that are on chronic prednisone, maybe some medications for autoimmune conditions. So those are specifically designed for that group of people. That is not the general public. So right now, we are not offering the third doses or the booster shots yet. Until the CDC and the FDA get together and come up with some more guidance about those the booster shots. We expect that guidance to come out hopefully by next week. The committee is supposed to meet at the end of this week, and we should have more guidance specifically regarding Pfizer. We don't think that the Moderna boosters are going to be quite as quick to come out. We think that the Pfizer booster is more likely to be recommended, but we don't know in whom. It might be in a subset of a population. So more to come, and keep in touch with your healthcare providers with all the questions, because things change week by week, and this is a moving target.
Today's news feature is brought to you by The Cheese Store and more. Go to their Facebook page to see their specials and check out their catering menu.